The South African Health Products Regulatory Authority, SAHPRA, has emphasized that it has not authorized Ivermectin for COVID-19 treatment. For more, we're joined by Dr. Boitumelo Semete-Makokotela. Doctor, thank you so much for your time. Perhaps let's just start off by clarifying the authority's stance on Ivermectin when it relates to COVID-19.
Thank you, and thanks for having us. And we were quite concerned when we saw, this clip that we had authorized Ivermectin for COVID-19. That's indeed not correct, and hence our quick response, because we need to ensure that the public has the right information, the correct information regarding this. So from a regulatory perspective, our view still remains to be that there's currently a clinical equipoise position, which means that we have insufficient evidence to say that this product works for the management or as a prophylaxis for COVID-19, but also there is insufficient evidence to say it doesn't work. And hence, in January of this year, we implemented the access control program, and that program continues to stand.
As it stands right now, what is Ivermectin used for?
Sure. So Ivermectin, as you know, many people know, it's a very old drug utilized mainly for the treatment of tropical diseases. In South Africa, beginning of the year until about a few weeks ago, we didn't have the product registered for human use. It was made available through Act 36 for veterinary use. And we had in our pipeline an application for a product it's a topical formulation, so you apply it on the skin for treatment again of inflammatory skin disease. So again, still very much far from a treatment of COVID-19. It is for the treatment of tropical diseases.
I can imagine yourself and the team are constantly looking at the scientific evidence as it relates to Ivermectin and COVID-19. Perhaps you can take us through where it stands right now and where you are unhappy when it comes to the efficacy of it.
Sure. So yes, indeed, we continue to look for any emerging data on this drug. And also, as we've said, we're encouraging clinical trials so that data can indeed be generated in the country and in other countries. So the latest study we saw was from Colombia, and it was a study of about 400 or so individuals. And again, in that study, they showed that when the patients were put on Ivermectin versus placebo, there was no statistical significant data or clinical outcomes in those two groups. So again, that's the latest piece of data that we have. We continue to monitor. And as we've indicated, our position still remains Ivermectin has not been authorized for the management and the treatment of COVID-19 as we speak. There is a program through which the medical practitioners, once they've done their assessment and their liability and responsibility is squarely with them, they can apply for access through this program, but they also have to report to us, in terms of how the patients are faring when they're on the product.
I understand there was a court proceeding earlier today. Perhaps you could tell us the outcome of those?
It's still in process, so I can't say much about it. So yeah, I'm also awaiting to hear what my legal team will tell me.
When it comes to the consequences of those who may be prescribing Ivermectin for, COVID-19, are there any legal consequences at this particular stage?
Yeah, so maybe I can share about, now that we've registered this topical formulation, right? It's basically a cream, right? It's called Solantrum. So now that we've got this cream registered and it contains the active, being the API, it means two things. It means that if one would like to make this product available to patients through what we call a finished formulation. So this is now when it's already a capsule. It's been brought into the country and it's been utilized. It has to be approved still through Section 21, through the process that we have. The second implication is that now that we've authorized the active, which is the Ivermectin, even though it's in a formulation of a cream, it enables what we call compounding, which means that you do have those pharmacies that can make a specific formulation for a specific patient when there's a specific prescription for a medical practitioner. So this is not in large quantities. So no one should be able to buy Ivermectin off the shelf No one should be advertising this product. Again, it's a Schedule 3 product. So it can only be available if it's formulated upon a prescription and for a specific patient. So this process has enabled that, which is something that we didn't have. So which means it can now be used off-label. But also it means that if there's a company that's importing it into the country as a finished product, so now it's in a capsule or a tablet formulation, they also then have to still get authorization from us as the product remains to be unregistered. So there is some technicality around it, and we've issued press statements around it, and there's information on our website in terms of what all of this means. But Ivermectin remains to be a product that's not authorized for the treatment of COVID-19.
All right, let's leave it there. Thank you so much for your time. Of course, that is Dr. Boitumelo Semete-Makokotela, who is the CEO of SAHPRA, clarifying again the use of Ivermectin, that it has not been authorized by the authority for the treatment of COVID-19. We'll have more news coming up.